Hello, everyone, and welcome to today's CSRT webinar. My name is Carolyn McCoy. I'm the Director of Accreditation and Professional Practice for the CSRT. I'm very pleased today to have Dr. Anita Gupta with us to present on coping with challenge and change during the COVID-19 pandemic. And Dr. Gupta has tailored this presentation specifically for respiratory therapists. She's a clinical health rehabilitation psychologist in Toronto, Ontario, and her clients include frontline healthcare providers. Dr. Gupta, thank you so much for being here and presenting to us. It's a real honor whenever someone from another profession takes time to come and speak to our profession. So I do want to thank you for that. And without any further ado, I'll turn things over to you.
Thank you so much, and please let me say thank you for allowing me to speak with you tonight. Before I even start, I just want to say thank you to each and every one of you for what you're doing for the patients, for the public. It's a lot. So today I wanted to talk about coping with challenge and change during the COVID-19 pandemic and try to have a specific lens for respiratory therapists. But some of the things I'm going to talk about apply to frontline healthcare providers generally. Okay, so the first thing I want to say is that I recognize that this is the time that we really want to be mindful of information overload. So I want to keep this fairly straightforward. There isn't anything you have to take notes on. There isn't anything that you have to study up on after. I want this hopefully to help you to identify what you're already doing that works, and maybe identify other things that maybe were impacting you that maybe you hadn't even realized. So I just only have one slide, one research slide up. Obviously, this is all very new. There's one paper out from China. They're ahead of us, of course. And so I just wanted to put this up there. And what they found was a considerable proportion of healthcare workers reported experiencing symptoms of depression, anxiety, insomnia, and distress, especially women, nurses, those in Wuhan, and frontline healthcare workers directly engaged in diagnosing, treating, or providing nursing care to patients with suspected or confirmed COVID-19. So I think that's not surprising. And I only put it up there just to show, of course, there's impact, right, of doing this kind of work. So I looked up headlines, right? I just kind of Googled respiratory therapists, COVID, and you might be surprised that I actually found some articles, and I think the titles kind of say a lot. Respiratory therapists are at the center of COVID-19's emotional toll. Respiratory therapists may be the best kept secret in the fight against coronavirus. The unknown is what's scary. This is in Spokane. Nurses and respiratory therapists describe challenges of COVID-19 care. And as I looked these up and I wrote this on this slide, I wondered if some of you might be thinking, really, there are headlines about us? Because most people say, what's a respiratory therapist? Who's a respiratory therapist? And, I wondered as I was putting this talk together, how that lack of recognition, if I'm right, if that does exist on some level, how that might make some things a little bit harder, as you are so central to what's happening right now. So as you all know, this is an evolving situation. So by the time you even watch this webinar, some things might have changed, right? We know that there's variability across the country, across provinces. We know there's variability within the same city in different hospitals, right? We know from week to week, sometimes in the same day, policies are changing, the message is changing for frontline healthcare providers and for the public. Right? So just even in the time that this pandemic has been going on, I would imagine for you that there have been some changes that have happened in terms of policies about PPE availability and use and, what's considered essential work. In Ontario on one day, certain people who were in construction were considered essential work. The next day, they weren't, right? And so that can have a lot of implications for families and for everyone. I think also the situation can evolve in terms of the personal impact of COVID-19 maybe increasing for you, your loved ones, or your colleagues, depending where they are. For example, maybe you know someone who's tested positive for COVID-19 and has recovered, or you start hearing more about healthcare providers who are dying, or you know of someone personally who has died who had COVID-19, or maybe even a loved one has died. And so we know that as personal impact increases, that can change, right? How this is impacting you and those around you. And of course, as I mentioned, the most prominent identified stressor may change very quickly for you. What seems most stressful today may change tomorrow or next week. So I think what we're all feeling, right, whether you are a respiratory therapist, another frontline healthcare provider, or a member of the public in general, this is a time of so much uncertainty, right, on so many fronts. And it's hard to think of a time when everyone around us is dealing with uncertainty. So that's kind of the background that I want to keep in mind as we're talking about things today. So the other thing that I think is important to talk about is just the universality of threat that is happening right now. It's hard to think of a situation, health or otherwise, where everyone you're dealing with is kind of experiencing impact from this thing, right? Whether it's your patient or your family members or your colleagues or your friends, it's a little bit harder to keep that separation between work and home. It's a little bit harder to keep that separation between this is an issue that's impacting my patient, not me, because the very fact that you are treating that patient means that it may impact you and your family or whatnot. So I think that's something else that I'm keeping in mind as I'm seeing my patients who are frontline healthcare providers. So I think the other thing to remember is that there was life before this pandemic, and that is impacting us, right? And so, you might want to ask yourself, how was I feeling before this pandemic even started? What was I thinking about? What were my plans, right? Some of you might have been about to take a new job, or maybe you just started a new job, or maybe you were planning a vacation or considering a leave. Maybe you weren't feeling well. You were going to take a medical leave. You're planning a wedding, or maybe you were thinking of ending your marriage, and now you are, in isolation with this person. Maybe you were about to start fertility treatments and that is kind of now on hold. Maybe you were about to retire or have retired and have had to make that transition back. Or maybe you were about to move to another city, province, country. All of these things can be in flux right now. And we know that any kind of change can also involve loss. Even if it's a positive change, there can be loss. And so I think it's thinking about how is your job different? That can actually involve loss. I'm thinking maybe some of you are more community-based, but you've been pulled into a hospital, right, because of the pandemic. What kind of losses might have occurred there? You're probably in the swing of things now, but at first, did you lose that sense of kind of just knowing what you're doing, right? Just having that everyday familiarity with what to do. What might you be grieving, right? For example, I was saying some of you might have been, about to get married or whatnot. What are those losses that you're feeling? Maybe you were about to go visit family members abroad, and that's not going to happen. Or you can't be with loved ones who are sick for totally other reasons other than COVID, right? You might want to think about what surprised you about the reactions that you've had. What's been more difficult than expected? Maybe what's been less difficult than what you expected with these changes. And that can be useful in terms of identifying what your needs are. And also kind of how are you treating yourself in the midst of all of this change? As background to talking about this, I just want to kind of talk about what happens when we feel anxious and stressed, because I think most people are feeling anxious and stressed in some ways. When we're anxious, we often are worried about the future or we're ruminating about the past, and it can make it really hard to be present, hard to be focused on what's needed now. And we know being present and focused is such an important part about being a healthcare provider. And I'm thinking in particular, being a respiratory therapist, emergencies are not new to you. Being in very acute situations is not new to you. But what might feel a little bit different is just the sheer mass of that. When we feel stressed, our focus turns to what seems most dominant, what's most important in that moment. And we become less focused on what may seem like peripheral information. But sometimes that peripheral information is really important too. So we'll kind of keep that in mind. And so, of course, even though we're feeling stressed and anxious, you still want to stay engaged and present at work. So despite anxiety, fear, discomfort, you still want to, you still are, you still have to work well, take care of your patients, be efficient and engaged. And how can you do that? So we'll come back to that. So I want to just start by talking about some of the challenges that respiratory therapists and other frontline healthcare providers may be experiencing. And you might be wondering, well, why is the psychologist bringing this up? We already know what we're facing. And I guess I want to challenge you on that a little bit. Sometimes when the stressors are so normative and everyone around you is having them, you might not even realize how much it is impacting you. Right? So I bring this up and you can kind of identify for yourself which of these challenges, which of these things apply to you and what don't. So the first thing I want to mention is just this idea of COVID-19 information overload, right? So I'm going to ask you the question, do you have any time in your day when you are not reading, learning, talking about COVID-19? And I think it's an important question. And your answer might have changed, right, from a few weeks ago to now, or from a month ago to now. But I think it's an important question. And if your answer is no, I have no time, then I think you might want to think about what the impact of that is. Okay. Understandably, there's so much information to stay on top of, right? There's probably, new policies, new clinical updates, changes in your expectations for your work, maybe from your hospital, from your professional association, public health, whatever it is. There's so much information coming at you. And it can feel a little strange because also the expectations and rules for the general public don't apply to frontline healthcare providers or to grocery workers, for example, right? And that can make it a little uncomfortable as well to have so much information that doesn't apply to you. And also sometimes as a healthcare provider, there can be that feeling of responsibility to disseminate credible health information to your personal circle or people maybe you haven't talked to in a long time, but who are reaching out. And I want to just maybe have you think a little bit about what might be some of the diminishing returns or the possible negative impacts of having too much information. I kind of talked about this before, but the rules and responsibilities are different for you than the public. Things like going to work as opposed to staying at home. And rules evolve and people can feel a lot of guilt or worry about that. So for example, maybe you were following what the rules were a month ago, but those rules have now changed, but you still are wondering what are the impacts of me following those rules before when maybe that wasn't really safe enough. Things are changing. Right? So quickly. And I think this is a time when we're not just impacted by worry about what we're doing now, but we're thinking about what's the impact of what we did 2 weeks ago or a month ago. What's the impact going to be in 2 weeks from now? And also, as I mentioned, the sense of responsibility. A lot of my clients are telling me, and most of my clients are physicians, but I'm talking about kind of healthcare providers in general, is that this is a time when a lot of family, friends are reaching out to them and maybe wanting to know what's going on in the hospital, what's happening, what do you think I should do? And that can be a lot. I think it's also important to recognize that as a respiratory therapist, as a healthcare provider, you also are getting skewed exposure, right, about information. You're not hearing about necessarily kind of the positive things that are happening by nature of your job itself. You are seeing people who are quite sick, I would imagine. And so when you are dealing with COVID, you are dealing with things that are more serious, and that can skew the nature, right? The feeds that you're getting, the emails that you're getting, your social media is probably more skewed. So that's important to think about too. And it's also a time when legal protections are changing, right? Rules guiding workload hours, they may no longer be in place. The type of work you're going to do may not fit the job description, right? I'm thinking about someone who might be redeployed. You might be doing something very different than what you thought you would be doing maybe, 4 months ago. And then also that moral distress that you might be feeling about some of the decisions that you have to make, or even the fact that, rules are different. We can come back to that a little bit. Okay, so what can we do about addressing COVID-19 information overload? I'm not saying don't read anything, don't do anything. That's not what I'm saying. That's not even realistic. But if we could incorporate more choice on what you're looking at, that would be really helpful, rather than that automatic, I must. So here's some examples. I think we all, I'm just going to grab my phone. A lot of us wake up and this is the first thing we look at, right? Is our phone. And what does that do? And then we start looking and we start reading everything. So what if instead, when you wake up in the morning, you get up, you go to the bathroom, you brush your teeth, you pee, take a shower, whatever you want to do. And then you make that decision to check your messages. Even urgent things can wait until you've used the bathroom, right? And then you're more alert, you're making an active decision to check. We often use our social media, our phone, or whatnot as an escape. But right now, it's not so much of an escape. And there's so much information coming in. And I've alluded to how your feeds might be particularly COVID related. And so rather than having that information just come to us whenever, you might want to think about setting some times to read news, social media, if you want to do so. Making some time for that, scheduling it. You don't have to do it just because you schedule it, but then you have some time rather than it coming. This is a time when you might want to think about maybe taking some apps off your phone, right? So if you want to look, you sign in, right? Rather than it coming to you. Or think about what chat groups you're on, what list group serves you're on. There's a lot, right? So making some choices. It's also a time when you might want to think about actually going old school and just having a clock in your room rather than your phone to check the time. You wake up in the middle of the night, you want to know what time. If you look at an alarm clock, you see the time. If you check it on here, it's really easy to start reading what else is on there. Right? Another question that I think you can ask yourself is, am I reading this information? Am I watching this news? What are you doing? Am I learning this information to try to feel prepared or to lower my anxiety? Or do I need this to do my job tomorrow or the next day? And if the answer is no to that last question, then I think you really maybe want to make a choice about it, right? Like, do I want to read this or not? And I think it's important that feeling prepared is not a feeling, right? And so kind of thinking about that. So for example, does knowing the exact numbers on the curve change how I'm going to treat my patients tomorrow? And I think that can be an important question for you to ask yourself. As I mentioned, recognizing the potential skewed nature of feeds as frontline healthcare providers can be really important as well, right? So also consider the roles that you feel obligated to play outside of work as a healthcare professional, but also maybe within work, right? I mean, this is the time when some people are also volunteering in addition to what they're already doing in their job, and maybe make that a choice. Is that the right thing for you at this time? This is a time when critical information is available for non-medical professionals, and it can be helpful sometimes to talk to family and friends if that is something that's happening to you, where they're asking a lot in terms of, hey, these are the sites that I think are really credible, or even, I'll come back to this, but this idea of, all I'm thinking about, all I'm talking about all day is COVID-19. It would be really helpful for me if we could have some conversations about some other things. And I think sometimes family and friends feel that it can be really helpful to have that information because they want to be supportive. And it's coming from such an innocent place, right? Asking what's going on. So you can think about that. That's my point here. Just really speaking to your friends and family about your needs with respect to COVID-19 discussions and generally whatever that is. I'm not saying don't talk about it, right? Like, I'm not saying it has to be banned, but I think right now it's become so automatic that how are you is kind of like, hey, how are you doing with COVID? And so if we make it a little less automatic, then the conversations you do have about it are probably going to be more relevant and more helpful. So if you are someone who has a lot of friends who are also healthcare providers, then you might want to think about, when you're socializing, virtually or whatnot, maybe even considering, hey, why don't we set like 10, 15 minutes at the beginning to talk about anything but COVID? And that can be really helpful because it means at the end of that time, people can opt out or they can stay in because they want to, or it's just kind of naturally, now you're talking about what really is relevant rather than that automatic nature of it happening. I don't know if people know about House Party or, there's all these apps that people are using. It can be kind of fun to doing something that is unrelated to just having a deep conversation sometimes. And so here at the bottom, I have aiming for more choice rather than musts or can'ts, right? Where can we bring some choice here? And you can think about what makes sense for you. I'm not saying this is a time about eliminating screens or virtual interactions. Like, of course, I'm not saying that. This is a time when virtual interactions are really so rich. And in some ways, they're changing to things that are much more beautiful than what they used to be. But consider how to incorporate those virtual interactions with friends and loved ones. And as I mentioned before, meaningful doesn't have to mean really intense, right? It can be setting up Zoom and maybe having dinner together, right? Or having dessert together or whatnot. It's Ramadan right now, right? And so I am suggesting to some of my clients, maybe that's something you can do, like have that Zoom open while you're breaking that fast. Having a tea or dinner together playing video, having a video on while your kids are playing or eating if you are having to be distanced from your kids because of safety issues or whatnot. Maybe watching television show together virtually or playing shared games like the Pictionary or whatnot, or maybe even doing fitness classes together with a shared screen. Time together doesn't always have to be deep conversation. I think some people are also doing, those art classes, those art tutorials together. I'm also mentioning some of this because as frontline healthcare providers, as respiratory therapists, you may not have time to even really know what's going on in the rest of the world in terms of some of these beautiful things that are happening virtually. And so that can be something else that you can maybe speak to your family and friends about in terms of asking them, hey, do you have any ideas? Like, I'm really wanting to work out, but what's up there or whatnot. This is also a time when there can be a lot of fear, anxiety, uncertainty about your own safety and that of others. And the circle of concern right now is potentially everyone. And that's a little bit unprecedented, right, from what we're usually used to. So, in terms of self, lack of or appropriateness of PPE, past, present, future, it all applies, right? Feeling compelled to make decisions maybe that may feel unsafe, but they fit with the demands of healthcare during this pandemic. Changing policies, expectations, and concerns about that impact. Now it's kind of hard, right? We don't even know if what we're doing is working for a while, and that's very unsettling. There's more and more information about healthcare provider infection and death, and that's going to impact healthcare providers in a specific way. A lot of people are thinking about people in New York, for example, right? Moving into work environments with increased COVID-19 exposure and the concern you might have about that, but even the implications of your own pre-existing medical conditions, right? The other thing is in terms of fear for loved ones. You may be worried about physical risk due to their contact with you, right? Either in the past or now. Concern about your loved ones who may be separated from you in distance or living with you who are at increased risk due to medical conditions or other factors. Maybe you're having to make difficult decisions about physically separating from your household or taking all those extra precautions. And family members' fears and conflicting wishes may be part of it as well, right? Maybe they don't want you to do the work they're doing. And this is, I think, a really different time where your fear may be beyond what's going to happen to my family if something happens to me, to if something happens to me, this could also happen to my family, right? If I get sick, my family could get sick. And I think that's a little bit different than what healthcare providers often experience. And of course, then extended networks, that could be anyone, anywhere. This is also a time when a lot of people are engaging in practical activities that make sense, but, they often are associated with anxiety, understandably. Taking care of wills, guardian decisions, conversations about loved ones, end-of-life preferences. And they're important things to have, but they can feel anxiety-provoking. The other thing, though, is that how can we engage in the now, right, as opposed to acting as if the worst has already happened? So, for example, I'm thinking of talking to a client who has a father who, because of a lot of medical conditions, is particularly at risk if he were to contract COVID. And so with all of the conversations being about what are we doing to minimize risk, what are you doing, what's happening with COVID, in some ways they were losing out, and this is like the family that's really close, they were losing out on just kind of hanging out together virtually in this case. And so in talking about some of their fears or whatnot, they were able also to talk about some other things and just be together. I guess I also want to bring up this question of, are you as a frontline healthcare provider trying to protect your loved ones from worry? Or are your loved ones maybe trying to protect you from worry? And so I think back to my cancer work, and oftentimes it wasn't uncommon that, the identified cancer patient wouldn't want to, I don't want to burden my family members. They're already dealing with enough. Or the family members, I don't want to burden the identified cancer patient because they're already dealing with enough. But what ends up happening is everyone's just worried, but they're not even sure if they're worried about the right thing, right? Because no one's really talking to each other. And so I would say right now, if this rings true to you, look, the truth is most people are worried. Everyone's worried right now about something. And so it can be really helpful to think about how can we talk about that, right? And so, I'm thinking about someone who, similar to what I said, was finding that the family members were always calling them and the healthcare provider was finding that their role was, no, don't worry, but was never talking about the fact that they were actually worried about their loved one as well. And by doing that, it then allowed them to talk about other things as well, right? People are not going to be surprised that you're worried. You're allowed to worry even though you're a respiratory therapist. You're not immune. You're still human. And so what I think happens is that if people start talking to their loved ones a little bit more, especially if that's what you used to do before this happened, I'm not saying that people stop worrying, but at least you're worrying about the right thing, right? Okay, so in terms of reaching out, I think when we're stressed, when we're feeling down, when we're feeling very overwhelmed, that's when we tend to shut down and stop reaching out. And sometimes reaching out, that opening up to a trusted other, can be very, very helpful. And I think we all know that in our lives, but it's kind of natural sometimes to turtle in. So thinking about what does that mean, accessing your support system, communicating your needs, recognizing it's okay to express your worries and fears. And if you do, then probably your loved ones will as well. It's a more real conversation. And of course, you're a healthcare provider, but you don't have to be the healthcare provider to everyone that you know, right? And also reaching out professional support. Maybe that's something that you were thinking would be helpful even before this pandemic happened. Then even more so now, it makes sense, right? Also, I think what if you're someone who's not working because there's a mandatory isolation, you're on mat leave, whatever that is? I think healthcare providers, I would imagine this is true for respiratory therapists as well, are very good at having guilt and feeling a lot of shoulds, right? And this can be a time when you're feeling guilty and having shoulds and worrying, and could be a time for more COVID-19 information overload, or, maybe you're in isolation, you're separated from family, implications of that. And I think it's really important to remember that going into isolation, if that's something that you're doing, is a really important thing, right? You would expect that of someone else. It's an important thing. And we don't know how long this is going to last, right? And so people are going to work, people are not going to work. There's going to be people coming in and out, and all of that is important. I guess the other thing is just how has work changed? And this can be a time when people are maybe feeling a bit disconnected from patients and or from their other colleagues. Certainly not having enough PPE is really scary, but using PPE adds extra stress as well, right? Remember, I was talking to someone and they were saying, oh my goodness, we did this whole procedure and it was only after I realized I was working with someone that I actually know really well, but everyone's so covered that they can't really see. It's a time when a lot of things that we usually do with eye contact isn't happening so much, right? How has your interactions changed with your patients, with your colleagues, right? With your patients' families? And, you know, whether that's because of PPE or visitors not allowed to be in the hospital, eye contact, physically distancing as you're working as much as you can. I think as a respiratory therapist, you probably are pretty close, right? But other people are keeping distance. How is that impacting? And what kinds of ways have you found to remain connected with your patients or colleagues? I remember seeing this beautiful picture. I don't know where it was, but there were nurses, and they had put a photo of themselves on their chest so their patients could see like what this human being actually looks like. And I thought that was so beautiful. This can be a time when nonverbal communication it's not happening, right? Like you can't really see each other very well. Or it's hard to even see like someone's face, right? Because there's a mask on them. And so it can be a time when replacing that nonverbal communication with more verbal communication very intentionally can be important. Using colleagues' names, right? Where normally you just make eye contact, or even, making symbols to each other, whatnot, like nice to see you, whatever that is. Just taking a second to be more verbal about some of that. And I'm not talking like right in the emergency, right? I'm talking about before, after, like all of those other times. I also think, I don't know, I'm seeing this. I don't know if the rest of you are seeing this, but as anxiety, fear, uncertainty is increasing, I think there's increased potential for conflict. Right? And that conflict can be on a number of levels. But this us versus them, me versus you, it could be hospital versus employee, could be interdisciplinary. It could be hierarchies that already exist. They feel like they're more problematic. Could be healthcare providers versus the general public, right? I know some people are feeling they really appreciate that people are coming out at, in Toronto at 7:30, I think in BC at 7 or whatnot. People coming out and banging pots and pans in support of frontline healthcare providers. But some people, are feeling more, I just want people to stay home. Like, I don't need that. That's not what I kind of want. And when you dig a little deeper, often that disconnect, that us versus them, is more about someone's own distress that they're feeling, right? And their worry and their fear. There's a lot going on, right? Healthcare provider versus patient, right? Spousal conflict. Someone may not be happy that you're taking on these shifts. Intergenerational family conflict. Maybe there are some parts of your family who are not really physically distancing, and that's making you feel really uncomfortable. And of course, all of these in the COVID world, it's what was going on, what's happening now, and then worry about the future. And I think, if we think about this, when we are feeling more irritated with someone else, it can be helpful to kind of remember this. So I'm thinking, sometimes people might say, well, I'm seeing all these people like walking around, like nobody's socially distancing. And I guess, I would say that might be the one time in a week, right, that someone is going for that walk, or maybe they're in an essential job and they have to go, or maybe that is their half an hour that they're taking a walk. We tend to make more assumptions when we're feeling this more us versus them, and it can be helpful to kind of keep that in mind. And I think also just recognizing that skewed nature of social media feeds you're going to hear more about people who are not doing something that follows the rules than all the people who are. I think, when we think about stresses, I don't know if anyone's heard of this SCARF model. David Rock talked about how emotional and psychological stress, we feel that akin to physical threat or pain, right? So our prefrontal cortex, it kind of downregulates, or we're more labile with our affect. It's harder to kind of stay focused. It's, all of these things. And the threats, if we have threats to our status, our certainty, our autonomy, our relatedness, our fairness. Relatedness is like, when you're on a really good team, all of those threats can make it harder for us to function, right? And can make us feel more distressed. And I think, outside of a pandemic, as a respiratory therapist, I am sure there are threats to all of these that can happen on any given day. But now it's happening kind of maybe more. Right. And I guess the other thing I would say about this us versus them, I think like in a time of an emergency, oftentimes this doesn't happen. People really pull together. But this, and you probably have experienced that a lot, but when it's a time that's this chronic emergency and we don't know when it's going to end, I think that's where it's harder. And those divisions that exist already feel a little bigger. right? And then, of course, you know, if you are working in a place that is not so like psychologically safe, then this is a time when that might be exacerbated, right? And so it's important to kind of remember that and be kind to yourself. You know, I think this is a really good infographic. It's how chronic stress can impact us. So, you know, we have stress and then we recover, right, through sleep or just time or whatnot. But what happens when you're in a time when you are having so many frequent stressors that there's no time to recover? And what happens is that that becomes our new normal. And we don't even realize, right? And so I'm just going to have you do an exercise and take your shoulders and just put them up to your ears, right? And try to relax. Like, good luck, right? And then just let them go and just feel that difference. And so I think oftentimes what happens is we don't even realize that our shoulders are here, right? That just feels normal now. And so it feels like, well, it was that little thing that set me off, but it wasn't a little thing. It was this much, right? We just didn't notice. So anyway, since we already did that, I'm just going to ask you to go ahead and just kind of release some tension as well. That is always helpful to do. You know, this is Dr. Janice is a psychologist who has created this wonderful workbook for frontline healthcare providers, and I've attached a link to it at the end of this workshop, and I can send it as well. I think this is kind of a humorous but probably not so untrue picture of what your bodies might be looking like right now, right? Your gray roots are showing, your shoulders are being worn as earrings, you're hungry, you know, your feet are sore, your back, like all of these things. And you might not even notice because it's just happening so insidiously. So attending to self-care is important. I think we all know that, but it can be kind of hard to do. So I think what's really important is to maybe have realistic expectations for yourself, right? You know, I'm not going to say, okay, make sure you're eating these 3 wonderful balanced meals every day and snacks. And I'm not going to say that, right? You know what's realistic for you. But are you running on empty, right? So is it just not going to be, you know, does it make sense right now to make sure you eat breakfast, right? So whatever happens in the day, you're not going to be running on empty. Or could you take a break to eat something? Could you bring things with you that you could eat? Just think about it, right? Because all of these things impact your attention, your fatigue, your headaches, like all of that stuff, it impacts. And taking that 5 minutes could have impact for the whole day. But also hydration. I think I'm getting a reputation as the pee psychologist or something because I ask every healthcare provider I work with, hey, do you ever pee at work? And if the answer is no, then there's likely some impact of dehydration, right? And so thinking about that. What were your barriers to staying hydrated and eating before COVID? And now what are the barriers now? Right? And some people might say, well, I feel guilty. I feel guilty because I have to throw away my PPE if I'm going to go have lunch and like it's so limited or whatnot. Okay, but this isn't just one day. This is a long time. So you want to think about making sure you have enough energy. Physical activity, right? This is a time when your job is quite physical, but that's not the same as moving, right? Moving for your benefit and thinking about, this is a time when we need it more than ever. So whether that's, looking up or having your family members look or your friends look up, some of the free online fitness activities that are going on, for example, on Facebook, there's a YMCA GTA, and they have instructors from their home doing things. And because it's live, they're live streamed, you can watch videos, but it feels really interactive. And it's also a way to engage in something that's really positive that's going on in the world right now. Whereas when you're so busy in healthcare, you might not realize that. Or I think this pandemic is maybe turning some people into runners or hikers. Getting outside can be really important. And I think, depending what province you're in and how the messaging was said, in some provinces there can be that sense of, no, stay inside, you must stay inside, means stay inside. But then when you look at the fine print of the rules, it in those provinces, it says you can go out to exercise, right? But it can feel a little strange doing that if you haven't. So thinking about that. And everyone I have talked to who has been able to increase their physical activity, hopefully outside a little bit, if it's safe, has said that they've really benefited from that. You are a person too, so think about your own pre-existing health needs as well. they're still important to take care of. So for sleep, I'm not going to talk a lot about sleep today, but I always go beyond sleep hygiene with my clients. I think we should always individualize and be realistic. But I think one question you can ask yourself is, what's not a sleep issue, but what am I doing maybe to restrict my sleep? So for example, is it I'm staying up to read all the news at night on my phone in bed? Is it I'm trying to stay up so late because I really don't want tomorrow to come? Right? Is it I wake up in the night and I'm on, like, whatever that is. What are you doing to restrict your sleep? There's an awful lot of people who are walking around as if they have a sleep disorder, but they don't. They're restricting, right? And so this is where COVID-19 information overload can also play into this as well. Right? And shift work, all of this stuff. But I also, I guess I want to mention, and I think that it is normative also to have some trouble sleeping, right, during such a time of stress. And of course, if it's chronic sleep issues, you want to address it, but also being kind with yourself if you're having a poor night's sleep. If you're having one poor night's sleep, the most that's likely to happen is you're going to feel pretty tired and you're going to be more irritable. So you can take that into account. But think about, what are you doing? Or are you, if you are not eating all day long and then you're just eating that like one big meal at the end of the day, that impacts sleep too, right? So fatigue is not just about sleep, it's all these things that we're doing in our day, right? Also, I think with sleep, maybe asking yourself, has your substance use changed? Right? Are you maybe having an extra glass of wine to help you sleep or whatnot? Yeah, it might help you fall asleep, but it actually changes the quality of your sleep. And of course, there's other issues that can exist with that. So yeah, like getting outside, whatever that means, right? Going for a walk, whatever that is. Also, this is a time when I think balconies can be used more for those people who are living in condos or apartments. I had a client who told me, yeah, I put my yoga mat on the balcony. I have this tiny balcony, but put my yoga mat out there and I put a chair out there and I'm like reading my book on the balcony. That's great, right? She's also getting outside too, but I think this is great. We can think about that. It's so important. So let's come back to this question, right? So, despite this anxiety, fear, discomfort, we still have to work. You still have to stay present and take care of your patients and be efficient and engaged. So how can you do that? So let's talk about that a little more. I think, one of the most important things we can do is take a moment to be present, right? And I really mean a moment. I'm very mindful that you are very busy, and I want to give you strategies that you can use at work that take seconds, okay? You can do it for longer if you want, but they can take seconds. And I think I alluded to before, when we're feeling anxious, it's hard to be present. We're worried about the future. We're ruminating. We're worried about what we did in the past. So being present can be really helpful. This is helpful in healthcare anyways, right? But during this time, it's maybe especially so. And so what I'm going to ask you to do actually while you're watching this webinar is I just want you to stand up and I just want you to go ahead and just stretch wherever you need it, like where your body needs it. Okay. Thank you for doing that, for just taking that second. I think especially when your work is so cognitive and there's so much going on, it's hard to then use cognitive strategies. So use your body, right? Our body carries things. Let it go, right? That can be really helpful. When we are anxious, when we're panicked, we go into fight or flight, right? Our breath gets really fast. Our heart rate is fast. And so it makes sense, right? Our body's just physiological response hasn't adapted. We still respond as if it's a saber-toothed tiger running at us. But the stressors you have now are not going to be solved by fighting or fleeing, right? And so if we can slow our breath, that does give our body the message that it's not as much of an emergency, right? In terms of yourself, right? And so you can do that in any way, right? You could just, one way is, you can do this right now. So I want you to just breathe in to the count of 4, hold for the count of 3, breathe out to the count of 5. Right? Just having your exhalation be a bit longer than your inhalation. Okay. Lots of other breath strategies. You could, I'm just going to have you close your eyes and maybe just pay attention to the air going into your nose, to your nostrils, and the breath coming out. And maybe you notice that the air going in is a bit cooler than the breath coming out. Sensory grounding, this is anything. You can just like name 4 things that you see. If you want to do the whole set, you can look around you and name 4 things that you see silently, 3 things that you hear. Normally I'd say touch 2 things, but in this COVID world, you don't have to do that if you're at work, but take a breath, note what you taste or smell. Okay. It just kind of slows you down. If you have a glass of water around you or coffee or anything, I'm just going to ask you to pick it up. And what I want you to do is I just want you to do this exercise. Okay. I just want you to be aware of the weight of the glass, the temperature. Put it to your lips. Take a sip. Notice the taste, the texture, the sensation of it on your tongue and down your throat. You just grounded yourself. You just made yourself present. And you just hydrated yourself, which is a chronic problem for healthcare providers. So I have to say in my practice, which is with healthcare providers, the 2 things that I find people say are most helpful are the stretch, right? And it can just take a second. And you don't have to do it when you're in pain. Just do it whenever you think of it, right? Do it right before you're about to start a procedure with a patient. Do it before you're going to chart. Do it as you're walking into the hospital. It just takes a second wherever you need it, right? And the water. The taking a sip. Now, I know in this time with PPE or whatnot, it might be a little harder, so you can figure out what works for you. But any kind of mindful practice, right, can be really helpful. And some of you might have more regular, longer mindful practice. That's great. But if not, these moments mean a lot, right? And we do it naturally when we're on vacation. Nobody has to tell us, oh, smell that ocean air, feel that sun on your skin, taste that margarita. Nobody has to tell you that, right? But we can do that here in our environment, right? Like maybe after you watch this webinar, wherever you are, as you walk out of the room, take 3 steps and do it really mindfully. Be aware as your feet hit the ground, the colors that you see, the sounds that you hear. Okay, it just helps be here. And these are things that are really helpful for healthcare providers at any time. So I do these. I do one, like I just take a second or whatnot, but I try to do one of these before I have my next patient come in, and I find that I'm able to be more engaged and present for that whole next hour. The other thing to remember is that I think sometimes people think mindful meditation or being focused is like maintaining your focus. It's not. It's normal to be distracted. It's really about practicing returning your focus. Okay? And we know what it's like when we're at work and we're not feeling focused. Things take longer, right? We repeat ourselves, whatever that is. So yeah, I'm not going to go through this slide, but there's lots of benefits in healthcare to practicing. And mindfulness does not have to be this big dose. I really do think mindful moments help a lot. And all of these things being present help us identify what do I need now. Sorry, I skipped some. I want to just go back. The one that I skipped is naming your emotion. And you might think, oh, that sounds really hokey. But I actually think it's really important, right? Because we don't do it very often. So even right now, you can sit there and you can just kind of think about, okay, what am I feeling? Maybe you're bored. Maybe you're interested. Maybe you're hungry. Maybe you're tired. Maybe you're anxious, whatever that is. And maybe you can ask yourself, where do I feel it in my body? And it's really helpful because it helps answer that question, what do I need now? And I think sometimes people think if I name my emotion, it's just going to get bigger, right? That's not what happens. It just actually more is explanatory and it grounds you in it. Okay, so let's talk about anxiety just a little bit more. I think some questions you can ask yourself is, what am I avoiding? What am I restricting? What am I working on and what's working on me, right? So for example, what am I avoiding? Maybe I am really avoiding talking to my spouse about how worried I'm feeling, right? Or maybe I'm restricting eating in the day, right? Or what am I working on? Maybe my charting has gotten really sloppy and I'm not getting to it, or like whatever that is. I think whatever we're not working on is often working on us. So if we can kind of do that first, that's helpful. So think about for yourself, right? When does it impact you? How does it impact you? I often ask my patients, when you feel anxious, where do you feel it in your body, right? And so some people say, oh, my shoulders, my chest, or whatnot. So that's something you can kind of work on. How does it impact your thoughts, your feelings, your physical sensations, your behaviors, right? Maybe it's, if I get really anxious, I know then I really just avoid talking to people, right? And maybe that's helpful to do, whatever it is for you, okay? what might be helpful to address now with respect to anxiety, either on your own or with someone else. I just wanted to throw this term up. I'm not sure if you know about it. So emotional reasoning is just this idea that when we're feeling an emotion strongly, whatever thoughts we're having take on a truthiness. They feel more true, even though they have not, the veracity of our cognitions has not changed, right? But if I'm feeling really anxious and I think, oh my goodness, I'm never going to be able to get through the day, it just feels more true. So just recognizing, naming your emotion can help identify what lens is impacting your thoughts. So I wanted to put out this question of what ifs, because I think this is the time when a lot of people are catastrophizing and thinking of what ifs. And I guess what I want to put out there is that what if is not actually a question. What if is another way of saying that can't happen. I will not be able to cope if that happens. So what I wanted to say is that if you find you are someone who is engaging in a lot of what if, this is going to sound a bit paradoxical, but actually let yourself go there. Jump over all the what ifs and go right to the end. What is the worst case scenario for you? And then ask yourself, what is the likelihood, low, medium, high, right? It's a guess, we never know, right? Regardless of what the answer is, then ask yourself, if that happened, what would I do? Note, I didn't say how would you feel, but what would you do? And the truth is, unless we are dead, there is always something we will do. Right? So let's say the worst case scenario, I was talking about a patient before, is the worst case scenario is that my father ends up getting diagnosed with COVID. Okay, what's the likelihood? Whatever that is, low, medium, high. If that happened, what would I do? Okay, so what I would do is I would make sure we can always answer that question. So this is a way to get out of that loop. The other thing I think is that if you can recognize what are your own problematic habitual thoughts, what are your tendencies here, that can be really, really important. And so especially in a time of greater stress, we can be a little harder with ourselves. So for example, maybe it's like I'm so stupid, or whatever that is, whatever that problem, like I should be faster, or I shouldn't get anxious, or whatever that is. So I'm just going to give you some quick tips. One is just even recognizing that it's a habitual thought can be helpful. Oh yeah, there it is, right? Because some of these just happen because of habit. Another thing, this is from acceptance and commitment therapy, you can create some distance from your critical thoughts instead of fighting them. So my mind is saying that I'm so stupid, or I like this one a lot more. I'm noticing that I'm having the thought that I'm so stupid, or even I'm noticing that I'm having the thought that I want to kill myself. You can use it with anything, and it gives a little bit of perspective and creates a little distance. I'm noticing that I'm having the thought that I am not going to be able to cope. Okay? It just gives some perspective. The other thing is, I think, ask yourself, would I speak the way I'm speaking to myself to a friend, right? Would I say to a friend, you're so stupid, you should have known better? What would I say to a friend in the same situation? And what can I do physically? Our bodies react to touch, right? This is a time when a lot of people are not getting a lot of touch. Our bodies even react to our own. Okay, so holding our hand or doing that can be helpful when you're feeling upset, or when you're speaking very harshly to yourself. I want to speak about compassion just a little bit. Kristen Neff is a psychologist who's done a lot of work, and there's a lot of myths about compassion. A lot of times people think, I have to have self-compassion to be compassionate. That's not true, right? You all know people, or maybe you are someone who can be very compassionate to others, but for yourself, when you experience challenge or change, you're very harsh with yourself, right? However, if you are compassionate to others and you don't have self-compassion, that increases the likelihood of burnout, right? So, I'm not going to get into this too much, but this is where you can think about, like, when you notice yourself being critical or harsh with yourself, or you're having a challenge, try to speak to yourself in the way that you would with a friend. What would the tone of voice be? What would the words that you would use? What would be your rate of speech? Okay, maybe you would hold hands, right? So anyways, we've talked about a lot of things. I hope some of it is relevant to what you're doing. I guess the last thing I want to say is that as respiratory therapists, as very highly trained professionals who are used to working in emergencies, who are used to working with babies to geriatric populations, who are used to working in the community, in the hospital, you have a lot of experience walking into something that you maybe didn't expect and knowing how to handle that and handling it. So it's not all about preparation. You are prepared by the nature of who you are, right? And the profession you have chosen. But maybe also you can think to yourself, ask yourself the question, what has helped me cope with change and uncertainty in the past? And maybe you could ask yourself, what do I need a bit more of now? So I'm just going to put up two resources here. The first is, it's a fact sheet that I wrote for CPA. It kind of covers some of the things that we talked about. And the bottom one is this wonderful resource. Dr. Melly Jonis is a psychologist in Ottawa, and she put together this really practical and funny, actually, workbook for frontline healthcare providers during COVID-19, and it's free to download. You can share it as you like. It's one of those you can pick up and put down, and so feel free to look at that. I also wanted to just put up, like, this is a time when if you do want to access a psychologist, there is a the first link is how you find a psychologist in general. It's from CPA. Some of you, depending where you work, might have some insurance coverage, and you can use your benefits for that. The Canadian Psychological Association also has an initiative right now where they're offering free psychological services to frontline healthcare providers during COVID, and I put the link there. There's lots of other initiatives too. There's some with psychotherapists in certain provinces, and every province seems to have their own thing as well. You can find it. But this is a time where, at least for people in my profession, we have moved over into doing things virtually. And that might mean in some ways it's an easier thing for you to do because you don't have to travel. And so you can think about that. Couples therapy is also something that is available right now. So anyways, I put that out there for you. And I guess I want to end it the way I had started, and I want to just say thank you so, so much for what you are doing for your patients and your public, what you've done before this pandemic, what you are doing now, what you will continue to do, COVID or otherwise related. And thank you so much for taking time out of your really, really busy schedule to attend this webinar. And here is my contact information if you would like to contact me. Thank you so much.
Great. So at this time, we will open it up to questions and answers. Just while we're waiting for some questions to come in, this is now the fourth time I've heard this presentation, and I'm taking something different away from it every time, or something extra away from it every time. And the first time I watched this, the line that really resonated with me, the question that you ask is, do you ever pee at work? And I can just imagine the responses that you got, Dr. Gupta. I'm guessing most people on the front lines were saying, geez, I haven't had time to stop and do that. And to give people permission for that self-care and to take a minute to take care for themselves, I think is so important. Are you finding that people receive that question well? Or do you find people tend to say, look, I'm just too busy?
Yeah, so I turned on the audio. I can't turn on the video. You can hear me? Like, that's okay?
Yes.
Yeah, it just doesn't give me the option for the video. So hopefully you can hear me. And so, you know what? I think it is, everyone loves the question. And so I think it's a question that's really relevant if you're in healthcare, whether you're in a pandemic or not. And it really makes people think. And so yeah, no, I've actually never had anyone respond badly to that question. So I keep asking it.
And some of the other things that have resonated with me from watching this is the permission to turn off the information overload and to be selective with the information that you take in. I really think it's wonderful that that you pointed out that it is okay to give yourself the permission to not have to be all things to all people at all times.
Yeah, I think, one thing that I didn't mention in the webinar, but something to think about is maybe scheduling some time in your day if you want to, watch the news or read things. You don't have to use that time, but sometimes scheduling that time can be helpful because often we're using, our social media as kind of an escape. So rather than it finding us the information, sometimes it can help to kind of schedule it.
Yeah, wonderful advice. So a question to the panelists for both of us, I think. Do you suggest taking extra clothes to work so you can change at the end of the shift during this pandemic? I haven't done that as a respiratory therapist in the past. Do you mind if I just present sort of the RT perspective on this, Dr. Gupta?
Oh, please, absolutely. I defer to that.
Okay. I know traditionally, and as hospitals have grown, there doesn't always tend to be locker room space, you know, and I've seen that across the country. I've had the luxury with my job of visiting hospitals from coast to coast, and locker space is at a premium. So a lot of people wear their scrubs to and from work. What I'm hearing a lot of RTs doing when they are in the COVID zones is they are changing at work. So they bring their scrubs to work, they put them on at work, and then they change before they leave. Their dirty scrubs go right into plastic and right into the wash when they get home. For those for whom that's not feasible, I've heard everything from wearing a pair of bicycle shorts and a tank top and taking the scrubs off in the parking lot to taking stuff off in the garage. So ideally, I would say yes, probably change at work. And if you can't, then certainly as soon as you get home, touch nothing until you've stripped off those dirty scrubs. I don't know if you have anything to add to that. Are you hearing about those? I mean, I think it speaks to the overall concern about bringing this virus home and potentially contaminating or transmitting it to friends and family members. Are you hearing a lot of that concern? I know certainly that's something we're hearing from members.
Yeah, you know, what kind of strikes me is, as I hear you answer that question, and I think of the question myself, is how there are so many added burdens and stressors that people are dealing with. And I think sometimes when we're thinking about, you know, the most serious things like, contracting a virus like death, what have you, we sometimes discount the cumulative impact of all of these other things. And so giving yourself kind of what you need with that, maybe you're finding you need like a second before you interact with your family or whatnot when you walk in the house, and just keeping in mind whatever that is that you need. If you're feeling overwhelmed, part of that is all of these things that seem small, but they add time, they add effort, they add thought. And it just, I don't know, I just think it speaks to how much you're coping with.
Yeah, those can be the proverbial straws that break the camel's back, so to speak.
Mm-hmm.
Yeah. And I'll just add one other thing to that question. With respect to sneakers, I've heard of everything from sneakers staying at work and to putting them in a Rubbermaid tote in the trunk of your car and leaving them just for work. So just some of those tips. I do know the CDC, the US CDC has instructions for dealing with laundry that may be contaminated, and these suggestions are consistent with those. You had mentioned the CPA fact sheets, and my family actually was looking at them last night, and there are some good ones there aimed at students and aimed at teenagers. There's so many different CPA fact sheets, and every single one of them seems to have really good nuggets of information. So for anyone that's still on the line, I would highly recommend you take a minute and go search out the Canadian Psychological Association's fact sheets. All right, well, no more questions are coming in, so I think we'll call that an evening. A few more thanks have come in. Thank you, Dr. Gupta. Thank you for the awesome leadership. Lots of comments thanking for the wonderful information, and just that it's very engaging and people felt fully engaged in what you're saying and they find the information very helpful. So thank you again so much from the bottom of my heart.
Oh, thank you, Carolyn. And really, thank you, everyone, for what you're doing. And, you know, people may not always know who respiratory therapists are, but I don't think there's anyone alive who hasn't had someone in their life benefit from the care of respiratory therapists. So thank you so much.